Assalamu alaikum. Welcome to the second interview of the second day of Arab Health. And right now we have Dr. Mounes Kalaawi. Welcome, Doctor. He is the co-founder and CEO of Clemenceau Medical Center, affiliated with Johns Hopkins Medicine International. He is also the founding chairman of Clemenceau Medicine International, an organization which aims to advance and spread its mission of patient care regionally. Dr. Mounes is a surgeon trained and certified by the Royal Colleges of Surgeons in Glasgow and England, and is certified in medical management from the American College of Physicians Executives, and was also awarded an MBA from the University of Massachusetts in the United States. Dr. Mounes was appointed as adjunct assistant professor in the Department of Surgery at Johns Hopkins University School of Medicine in Baltimore, USA. A very impressive resume.
Thank you.
Welcome, Dr. Mounes. We are very glad to have you and Clemenceau Medical Center with us with this Thought Leaders series. Uh, Tell us more about Clemenceau Medical Center Dubai and what are your major milestones so far?
Well, Clemenceau Medical Center in Dubai is an idea pioneered by an Emirati founders who decided that they need to establish a center of excellence and that can add value
Yes.
to the healthcare system in Dubai and the United Arab Emirates.
Yes.
The idea was that this center be providing too many services that many patients used to travel abroad
Yes.
to have these services.
Yes.
Instead of that, bringing these services through the Clemenceau Medical Center here in Dubai to their doorstep.
Yes.
So from here it came the cooperation and collaboration, which started 5-6 years ago
Yes.
by the group here in Emirates and ourselves. As you know, CMC is established 20 years ago in Beirut.
Yes.
And in 2008, we established Clemenceau Medicine, which is carrying the concept of the CMC healthcare delivery to spread the brand, the name, and
It's a
the
very
quality
well-known name, yes, in Lebanon and around the Arab
to
world.
the region.
Yes.
Dubai project was based on that, raised in a partnership between us and Khan Sahib and Dubai Investment here, really to establish a state-of-the-art healthcare facilities. Starting from the basic things to the design, to the health planning, to the selection of technology,
Yes.
creating a smart hospital,
Yes.
because we know today the importance of a smart hospital
Yes.
in delivery of healthcare. This hospital have been established and officially opened a year and a couple of months ago. Of course, the major milestone is that we are proud of that we opened by the time when the pandemic just started,
Yes.
and standing shoulder to shoulder with Dubai Healthcare City in fighting the pandemic.
True
and,
partners.
and,
Yes.
and doing utmost things that we can do really to keep the facility standing on its feet
Yes.
and protecting and treating the COVID patients was a major milestone and an experience I think we'll never forget.
Yes.
In not only here in Dubai but all in Clemenceau network.
Yes.
Today, the other milestone from the last 7 or 8 months, CMC Dubai start now to attract top name physicians, all of them coming from international institutes in the United States and Europe. In addition, of course, to cooperation with well-known physicians here in Dubai
Yes.
and the Emirates, we start to introduce a new innovation and new technology that really provide a different kind of service and higher quality and new modalities of treatment, putting in our mind all the time that this service should be unique and it is directed, it is a patient focused care
Yes.
where quality, safety, and not a normal medical care, the best of care that can be provided can be given to our patients in Dubai and the United Arab Emirates.
Of course, the patient should always be at the center of any treatment
Exactly.
modality. Yes, we have been witnessing a trend in healthcare towards hospitals forming networks and affiliations. Are there different operating models for that? And in your opinion, are some more successful than others?
Yes, I mean the affiliation and the cooperation are existing now in too many facilities. We are one of the, I think, the first who start affiliation in the region 20 years ago.
Mm-hmm.
In our first facility where we affiliated to Johns Hopkins in United States,
Yes.
and it was very successful affiliation because at that time, 20 years ago, we were introduced to new concept in healthcare delivery, the evidence-based medicine at that days, the quality of care, the
Yes.
accreditation, the new modalities, the policy and procedure, the clinical pathway at these days. It was very important to us, and we learned a lot from that
And it
affiliation.
was very novel at the time. It wasn't
Exactly,
something very
exactly.
common
Now,
like these days.
exactly. Now, over the years, this concept is slowly changing.
Yes.
It's going from affiliation, name usage, knowledge transfer to more of partnership
Yes.
and collaboration, where we feel that being a partner in a project, this will really do a lot of benefit to the project. First of all, you give all your knowledge without limits. This is your project.
Yes.
It prevents the non-presence of accountability for these projects, and you exchange resources, you exchange know-how,
Yes.
and being part of a network. Eventually, if this network get bigger to include 3 or 4 or 5 hospitals in the region, networking is very important.
Mm-hmm.
It's a new modality of relationship between hospitals, different from affiliation and partnership.
Yes.
Networking under one umbrella of a brand give the hospital the strength when it comes to human resource, when it comes to supply chain
Yes.
and purchasing power, when it comes to patient uh, 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 best care by bringing the best resource available, by creating center of excellence between the network, that these networks, some of them is focusing on a center of excellence while the other is focusing on another center of excellence. You know, we are here also very close country to each other. Having a network also, we can share talented and retain talented physician and surgeon to practice complicated procedure.
Yes.
And not to forget, of course, here that networking will give a great platform for innovation and research.
Yes.
And medicine, at the end of the day, it's today is all based on innovation and research. Networking is really a major factor in that, and I think this is the future in healthcare.
I couldn't agree more. So right now, CMC Dubai is affiliated with Johns Hopkins.
CMC Dubai in Beirut is affiliated with John Hopkins,
Yes.
but the CMC now network is a standalone hospitals in Dubai and in Beirut and in other country under
Yes.
one umbrella of Clemenceau Medicine.
Wonderful. So
But we have cooperation with all major institutes. We have a very close cooperation here with Johns Hopkins
yes.
and with other institutes, and this is now is developing slowly, maybe to a more of than collaboration. It can become more of a serious joint program together,
Yes.
that the patients, the residents, citizen, and in Dubai and in the UAE and even in the region, CMC Dubai can be the hub for these services.
Wonderful. So these are some of the advantages that can arise from these affiliations. What are some challenges that can be faced when we think about innovation in practice?
Challenges are too many. First, manpower. Innovation in practice. It need innovation. You asking about innovation or affiliation?
No, no, innovation in general.
Innovation,
Yes.
exactly. The five major factors for innovation to be successful is the human resource,
Yes.
the manpower,
Yes.
the funding, the government regulation,
Yes.
and the technology and the training of manpower. These are the main factors. Human resource is very important. Empowering people, training leadership, preparing them for this innovation is really a very important task to start this and overcome this obstacle of a human resource.
Yes.
You need to start very early in developing personal skills, leadership training to be prepared really to lead and work on this on innovation.
100%. Strong leadership is key, definitely.
Definitely, technology also is a major factor.
Yes.
And it is very costly nowadays. Technology is changing very rapidly. Here, this we can overcome by collaboration with the industry, big industry leaders, by creating a partnership with them, really to try to introduce these new technology and services to the community and to our patients. Funding is again a major issue because innovation there is investment. Again, this takes us to the point previously I mentioned. Through partnership with the industry leaders and the provider, we can really diminish the cost.
Yes.
Definitely, the ease of government and authorities' regulatory mechanism, this will facilitate introduction of new technology and new services.
Definitely, not to toot our own horn, but definitely Dubai is one of the best and most attractive locations for innovative business models and these kinds of collaborations that make technologies more accessible to the patients and the community at large.
Exactly.
You mentioned earlier that you strive to make CMC Dubai a smart hospital. We keep hearing this term. What do you exactly mean by a smart hospital? And especially after the COVID pandemic happened, we had to be very reactive and act quickly.
A smart hospital today is very important. A smart hospital today is not very important for the hospital and the staff itself. It is very important for the patients. The patients today need to have a hospital which accessible,
Yes.
can provide to him his advice and the right choice easy, can reach
Anticipates even the needs before, yes.
his results. And also smart hospital can tell the patients before doing any procedure where I'm going. At the same time, during the procedure, smart hospital can secure a lot of safety and the quality of the services you provide to the patients. And smart hospital also can benefit the patients a lot after care for the follow-up and for following up on these patients to be sure that their course is going on smoothly. Today, a smart hospital includes too many things. Artificial intelligence, robotic surgery,
Yes.
electronic,
Wearables.
electronic health records. All these innovations are very important for the hospital to be smart. Even the access, the patient's appointment, the ease of and the option to the patient to choose what's the right treatment for him.
Yes.
That patients today he participate in decision making when it comes to
Exactly.
his treatment.
Yes. Now the concept of human-centered design is emerging in healthcare, where the patient, as like you said, is at the center of innovation. It's not about what the designer thinks the patient wants or what the researcher thinks the patient wants. It's going directly to the patient and understanding their needs straight from the source. Yes, wonderful. Final question that I ask to all my guests. How do you see the future of healthcare, especially in terms of research and innovation in the UAE over the next decade?
Well, I think the future in UAE and Dubai is promising. I think we all following the step also of the master plan for urban 2040,
Yes.
where Dubai become the citizen and the residents of Dubai and the Emirate. They feel that they are proud of the best services that came provided
Yes.
for them, improving the quality of services, and everybody on this country feel that he is in safe hands
Yes.
and he can receive not a medical treatment but the best medical treatment in the world.
Yes.
And Dubai, I think, and the UAE is really the platform. Uh, if 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 the if the well is there, I think we are looking to Dubai and UAE as a major destination for healthcare travel, not only from the region but even beyond the region.
Dr. Mounes, it's been a pleasure. Thank you so much for joining
Thank
us
you very
today.
much. Thank you for
Have a good day.
thank you.